So, table 6-5 are the muscles of respiration. So, respiration is breathing. Guys, I literally have a cat on my back. Okay. You come get her.
No.
Thanks. So, the external intercostals are, let me remove some of these layers. Okay. So you can see the fiber direction of the external intercostals. They run downward. Well, yes, they run downward towards the middle. So they run from lateral to medial. And if I were to hide these muscles, you would see the internal intercostals. And you can see that the fibers for the internal intercostals run from medial to lateral. So the fibers run in opposite directions. Another hint of deciphering the internal from the external intercostals are the internal intercostals will go all the way to the margin of the sternum, where the external intercostals will end where the ribs end. So there is this white stuff in the middle, but that is cartilage covered with a membrane. It's not at the actual rib. But the external intercostals, they really don't go past the point of the actual ribs. So the internal intercostals peak out in the middle behind the external intercostals. So the action of these muscles is very different too. So the action of the external intercostals is to inflate the rib cage when you breathe in. So with normal respiration, you breathe in, then your muscles relax and air is expelled. So you breathe in and it relaxes and you exhale. You don't really have to use muscles to exhale. So the external intercostals are responsible for that first inhalation of air. The internal intercostals are responsible for forced exhalation. So we call the air coming in and out normally your tidal volume. So if you wanted to get out all the rest of the air in your lungs, which is called the reserve volume, you would have to force it out like a that's where you will use the internal intercostals. So they have two different actions. Make sure you know the difference between the two. And then the last muscle here in respiration is the diaphragm. And the diaphragm is this dome-shaped muscle that separates the thoracic cage from the abdominal cavity. And in this picture, it is in a relaxed position. So when it contracts, it flattens and it causes an expansion of the bottom half of the rib cage. So your lungs don't have any muscles in them. They're passive organs. So the way that the lungs inflate is they have a membrane attached to them, which is one of the pleural linings. And the pleural lining will pull the lung open, but that pleural lining also has a layer that's attached to the inside of the thoracic cage and also the diaphragm. So when the diaphragm pulls down and the thoracic cage pulls out, those linings cause the lungs to expand along with the muscles moving. So, and then air will come in because of the negative pressure in your lungs. There's more air outside than there is inside your lungs. So when you expand it, the air comes down into your lungs. So the diaphragm is an important muscle in singing. Vocal coaches will teach you how to isolate the diaphragm and to use it to help with breath support